Just 2 days after the U.S. announced that we've now surpassed 600,000 COVID-19 deaths, troubling new information has been revealed on how many of those who were black could have been saved, how many could still be alive today. According to a new study just released today, a higher COVID-19 mortality rate among black patients has been linked to unequal hospital quality. And if black patients were admitted to the same hospitals that serve a majority white patients, that risk of death would drop by 10%. Researchers from the Perelman School of Medicine at the University of Pennsylvania and Optum Labs found that, quote, black patients have worse outcomes largely because they tend to go to worse performing hospitals. These new findings tell a story of racial residential segregation and reflect our country's racial history that has been highlighted by the pandemic. People often assume that black-white differences in mortality are due to higher rates of chronic health conditions among black individuals. But time and time again, research has shown that where black patients get their care is more important, and that if you account for that where they go to be hospitalized, differences in mortality vanish. According to the COVID Racial Data Tracker, which stopped collecting data in March, more than 73,000 black souls have been lost to COVID-19. The inability to locate up-to-date data by race is probably a story by itself. But we do know that black people account for 15% of COVID-19 deaths where race is known, and black death rates are twice as high as that of white people. Joining me now to discuss is BNC's Chief Medical Editor, Dr. Corey Hebert. Dr. Hebert, thank you for coming on, sir.
Thank you for having me. That was some sobering news for your audience, I'm sure.
So what do you make of this? I mean, we've been talking for months, over a year, about black people having these pre-existing conditions, comorbidities. This study says that if they were just going to better hospitals, had access to better hospitals, that it cuts into that differential of morbidity between black and white and kind of does away with a lot of the issue of comorbidities.
Well, I'll tell you this, Charles. If you, I'm in Salem, Oregon right now, and I was just in Idaho yesterday, and they don't have a lot of oceanfront land in Idaho, and I would like to sell you oceanfront land in Idaho if you at any point thought that the system that has systemically caused black death and stopped access to African American for health care in this country was going to do anything different during COVID-19 when they were not prepared in any way to even take care of white patients with COVID-19, then you should buy a lot of that oceanfront land in Idaho, because this country has been at the point, on the brink of destruction of African American lives because of hospitalization rates that are astronomically high when it comes to white hospitalization rates, and the service and the ability for us to get quality health care has always been a suspect. We know right now that if you're a black man and you go into a hospital with chest pain, the odds of you dying are tenfold higher, and the odds of you getting an EKG and an echo are 10 times lower than if you're your white counterparts. We know if you're an African American child and you go into a hospital and there's not a black doctor taking care of you inpatient, the odds of you dying go up tenfold. If you're an African American mother and you are going to deliver a baby in a hospital in America, you have a chance of dying like you are in a third world country. So this COVID-19, it didn't shine a light on a problem that was already existing. It put a high LED intense floodlight on a problem that is a $2 billion problem that has never been addressed, because just because you have black people at the table doesn't mean the appropriate black people are making decisions. Just because you have an MD doesn't mean that you can know what's happening in the Bronx or in a place where black people live, and you can actually understand and make those decisions.
So But you're describing, structural problems here, and and we're still not out of the woods on this pandemic. Black people still getting infected at higher rates than other people, and the scientists tell us the next pandemic is coming. It's not a question of if, it's a question of when. And if we haven't dealt with these structural problems of things like quality of hospital and racial segregation, which leads to people funneling into subpar hospitals, what do we do? What is the path forward here?
Okay, the path forward is that we have to actually address the social determinants of health, where we live, where we love, where we work, where we play. The systemic issues that exist because of the segregation of medical care, the segregation of religion, the segregation of education, the segregation of everything in America, which we try to say it's a melting pot, but it is not. Once we have all those things that are systemically made for us to fail, then we cannot actually survive. And so when you mention the second pandemic, another pandemic, the pandemic that's coming in the fall, I just want you to bear with me here. I need you to hear this because Black people need to hear this. If we know right now that pharmaceutical companies are making these the boosters. Okay, I do the clinical trials on these boosters. They're not making them so that the vaccines can last longer. They're making the boosters so that the vaccines can cover the variants better. Just know that. So if half the people in America are still not vaccinated, less than half, way less than half of Black people are vaccinated. Right? And then you have to get a booster. That means that half of the half are not going to be fully covered. Then what happens? The virus is not replicating right now because it's the summer. But when we have to go back indoors, the virus replicates better because it's a cold environment. Half of the people of America that are Black will not be vaccinated with the primary vaccine or the booster. So what's going to happen? The virus has not left. The virus is never going to leave. So what's going to happen? More Black people are going to die. That's why I'm telling Black people now, we must get vaccinated in preparation for the fall because it's going to destroy our culture if we don't, because the healthcare system is not about to change. So the only thing you can change is to prepare yourself for the disaster that is inevitable if we don't do what we're supposed to do.
Dr. Aber, very sobering assessment, sir. Scary, actually. Anyway, thank you for joining me.
Thank you.